the people on the call did the original practice nurse cancer care review training. So that's why we put this programme together. So if we go on to the next slide, please, Tom. So there's our agenda, which I think you've all seen, which hopefully will just give you that update that was requested. Next slide, Tom. And next one. So really, I suppose it's just to remind us all about the changing story of cancer. And over the last sort of 25 years, the population of people living with cancer has just been increasing. And if you look at that bottom line, 1970, average survival for all cancers was just a year. And I suppose there is still the legacy that most people dread that diagnosis of cancer. If you move on to 1992 years, the average survival, sorry, 20 years on, the average survival was only 2 years. So we weren't really making much progress. But by 2015, average survival was 10 years. And certainly by 2040, people will be living with their cancers. Many more are being cured of their cancers, but a lot of people who are cured of their cancers still have long-term consequences of their cancer treatment. But increasingly, we see cancer as a long-term condition. And so many of you on this call are involved with long-term conditions, whether it's diabetes or whatever. And I think the interesting thing too is to see about the demographics. And cancer still is primarily a disease of an older age group, over the 65, because of course people are living longer. Your chronic disease management clinics are full of people with cardiovascular disease, stroke, hypertension, and if you go back sort of 20, 30 years ago, people were dying of their strokes and their heart attacks, but of course people survive them. They live increasingly a longer life, so they almost have more chance to develop cancer. We know that 70% of people with cancer have one or more long-term conditions. But it's really important, I think, to take on board this growing number of more elderly patients with often quite complex comorbidities. And Sarah Zadie will talk to you about frailty and the impact that has within the cancer agenda. Next slide, please. So again, if you have a little look at the 3 cancer groups, and this is sort of based on analysis of survival rates refined by some clinical insight, we can group the majority of cancers into 3 groups. So group 1, and if you look on the side, it's talking about staging. Group 1, many live for more than a decade. A lot of those patients are cured of their cancers. And of course, it does underline the importance of early diagnosis. And of course, as primary care frontline staff, clinicians, admin, we are key to early diagnosis, not only with screening, but that 2-week wait referral. But again, within that group 1, while they may be cured of their cancer, they often live with the consequences. And I'll go on to that in a minute. Then you have the group 2 cancers. And so these are people who are really living with their cancer as a long-term condition. And it is really interesting because as a GP of sort of over many years now, and I'm sure a lot of you are seeing patients who have been told they've got metastatic, say, breast cancer, but actually are living with it. Whereas we'd be thinking, oh, well, perhaps a year's prognosis. But because of different treatments, people can live with their cancers, not necessarily, and die with them rather than from them. So we put in about frailty, and I won't go into frailty at the moment because we have the expert on this webinar, so I'll leave that to Sarah. And then, of course, you've got group 3, where survival is quite short term, and these are for those later stage presentations. And we know that particularly brain, pancreatic cancer, some of those cancers present late. And of course, late presentation means that outcomes are going to be poorer. And just to sort of, put a little bit of context of what COVID has done, we are seeing increasing numbers of emergency presentations of cancer because people have not come forward with their symptoms, or people are frightened to go and get treatment or diagnostics. And in the east of England, we have the highest number of emergency presentations. So next slide, please. And as I said, you know, people living with cancer often do have side effects. So living with cancer does not mean people are living well. There are so many different issues that patients have to deal with. Physical, so whether it's continence issues, whether it's osteoporosis, cardiovascular problems, but a great deal of people suffer with emotional distress, anxiety. They often have depression, and this slide is sort of explaining all of that. 1 in 5 people living with and beyond cancer may have unmet needs. And again, just to bring it back to us in primary care and the community, this is really why, you know, these cancer care reviews, and hopefully if we can do this as a group cancer care review, will offer patients that extra support, signpost them to other organisations or agencies that can actually help them through their cancer journey. Next slide, please. And again, that's just a little bit of information about how many patients we would be expecting to see in primary care. You know, over half of them will have been diagnosed more than 5 years ago. We do know, the evidence shows that people who've had a cancer diagnosis attend more frequently than other patients of the same age. So often they are trying to find out, you know, how do I now live my life? And we really are pushing for self-management, really, really important for that. Next slide, please.